So the other category we talk about is nuclear stress testing. So we have a nuclear exercise stress test, a nuclear pharmacologic stress test, which would be Lexiscan, persantine, or adenosine, and then a nuclear dobutamine stress test. So the other categories that we talked about were non-nuclear. So that means that with nuclear stress testing, we do a stress test, and then they also go to nuclear medicine where they have a scan done. So when you link a stress test with another imaging modality, such as nuclear medicine, you get a lot more detail because you have the stress test and you also have the nuclear images. So a lot of times they don't do the plain old stress test anymore where they just walk them on the treadmill. They almost always link it with another imaging modality like nuclear medicine or cardiac sonography. Just a picture of a nuclear medicine room. So nuclear stress testing, we have nuclear isotopes, so thallium, myoview, and cardiolite are a few of those nuclear isotopes. And when those get injected into the patient, a nuclear medicine technologist is the one that will come into the room with the isotope, and they will be the ones that inject the isotope into the patient's IV. The pharmacologic stress test, dobutamine, we use that when a patient cannot walk on a treadmill, and we also use adenosine, persantine when they cannot walk on a treadmill. We inject adenosine, persantine over 6 minutes. After 3 minutes, then they inject the nuclear isotope. Lexiscan is a newer medication that's also used for pharmacologic stress tests. The benefits of Lexiscan is it can just be pushed in over 15 seconds. It does not need to be infused over several minutes, and they also have minimal side effects with this medication. You very rarely need to use a reversal agent, but it is costly, so it's insurance dependent on if they will allow the patient to have that kind of medication. So the nuclear stress test flow of events. So the IV injection of the nuclear isotope, this allows the camera to pick up pictures of the heart. So it's radioactive. So we do a resting scan of the patient. So the patient lies supine with their arms above their head while the camera takes pictures of the patient's resting heart. So this patient is going to start off in nuclear medicine. They have a resting scan done. Then they come to our area and we do a treadmill stress test. So they'll come over to us and we will do a resting and standing blood pressure and EKG, and we'll get them prepped for the treadmill test, and we'll walk them on the treadmill using the Bruce protocol until they reach their target heart rate. When the patient begins to get tired, the nuclear medicine tech will come in and inject the nuclear isotope. And once that's injected, the patient needs to be able to walk for 1 or 2 more minutes to circulate the isotope throughout the body. So you just want to make sure that you're talking to your patient throughout the procedure, so they're able to continue walking for another minute to circulate that. And then that isotope allows the camera to scan the heart during the stressed state. So then once they're done with the treadmill test, they will go back to nuclear medicine and have the stress scan done. So this is done approximately half an hour after the stress test. So again, they lie supine with their arms above their head while the camera takes pictures of the heart post-stress test. So when patients have a nuclear stress test, they're in the department for roughly 2 hours. So the purpose is to evaluate coronary artery perfusion of the myocardium. The procedure, again, is we give them a nuclear isotope through their IV. This enables the scanner to take pictures of the heart during the resting scan. Once the resting scan is finished, the patient will walk on the treadmill until they reach their target heart rate. Then they'll get a second injection of the nuclear isotope, and then that allows the camera to scan the heart during the stress state. So now the next one is nuclear Lexiscan, Persantine, or adenosine. So this is a nuclear pharmacologic stress test. So this is for patients who are unable to exercise. They cannot walk on the treadmill. So again, same reason, to evaluate perfusion of the myocardium. And these medications are going to dilate the coronary vessels as well as the systemic vessels. So indications is inability to exercise, if they have asymptomatic ischemia, exercise tolerance at the beginning of cardiac rehab, if they have any arrhythmias, or if they have any chest pain. Contraindications are the same as a regular stress test: unstable angina, uncontrolled hypertension, severe AS, CHF, and uncontrolled arrhythmia. Again, so there is a patient prep for a nuclear pharmacologic stress test, nothing by mouth, 3 to 4 hours prior to the test. Patients with diabetes should check with their physician. The patient should ask their physician if they can take their routine medicines. And then again, if they're on a beta blocker, they need to stop this 72 hours before the procedure. And again, no smoking or caffeine. And like I said before, this prep can change hospital to hospital. So the procedure for the nuclear pharmacologic stress test is we start an IV. They get the injection with nuclear isotope. We get a resting scan. Then we get the resting EKG, resting blood pressure. The pharmacologic agent is injected. And once that is working, then the nuclear isotope is injected. Post-procedure, they get an exercise scan. Now, the reversal agent for any of the medications listed above is aminophylline, and you do need to know that. So that is the reversal agent we give to reverse the side effects if they get too severe for the patient. And again, there's typically no side effects with Lexiscan. And a nuclear dobutamine stress test is the last one, and it's the same purpose here, is to evaluate myocardial perfusion, usually ordered if patients cannot walk on the treadmill or if they have a medical history of asthma. So the same procedure as before, and I won't read through it again, but it's the same procedure as before, but this time they're going to infuse dobutamine before they give the nuclear isotope. Dobutamine increases the heart rate and mimics exercise. Lexiscan, Persantine, and adenosine do not increase the heart rate. They cause vasodilatation of the coronaries. This is just a picture of nuclear medicine of the scan, and I highly recommend that when you do your clinical rotation that you do follow these patients from the very beginning so you can observe in nuclear medicine and hopefully ask some questions over there, so this makes a little more sense. So redistribution, if the patient has ischemia, the isotope will not go to that part of the heart, so that's what they're looking for on the nuclear medicine scan. And then when the patient goes back for their second set of pictures, if the isotope redistributes and goes to the ischemic area, that usually means it's indicative of coronary artery disease. So indications for termination of the stress test. If you have a drop in blood pressure, because as we're increasing workload, blood pressure and heart rate should be going up. So if there's a drop in blood pressure, you would want to stop the test. If they have moderate to severe angina, if they get dizzy, if they want to stop the procedure, if they have sustained ventricular tachycardia, and if you have any trouble with the equipment, you would stop the procedure. And also if you see any ST elevation greater than 1 millimeter, you would stop the procedure. So if you would see ST elevation and you think the patient is having an evolving MI, they would go right from the stress testing area to the cath lab. So there are relative indications. Again, a drop in blood pressure might be a relative contraindication. ST depression, if they're getting tired, if they have increased chest pain. Arrhythmia other than ventricular tachycardia. So if we see some PVCs or SVT, they may or may not stop the test, dependent on the patient's symptoms. Interpretation of a stress test, and this is done by the cardiologist or the physician assistant. This is not done by cardiographic technicians. So a positive exercise stress test is not good. So if you hear that someone had a positive stress test, that means that they failed the stress test. So the physician's going to look at the EKGs that were printed out during the procedure, and they're going to determine if there's depression or elevation in the ST segments. Other findings that we can see on a stress test: they might have angina, but they might not have ST segment changes. We might see PVCs, we might see ventricular tachycardia, we might see an SVT, and there may be T-wave abnormalities. And we may see premature beats like PACs or PVCs that tend to disappear with exercise, or they tend to disappear once they're done exercising. So just a note, the patient can have a normal EKG but have an abnormal imaging study. So just because the treadmill testing part of it is normal does not mean that the nuclear part or the echo part will necessarily be normal.